There is a disconnect between the bureaucracy in our government and what goes on at the bedside in a hospital.
A leading patient rights advocate is sounding the alarm on the lack of patient representation on the board of directors of Sante Quebec, which is the crown corporation that would be set up to run the province's health system under Medicare.
So we know that at very high level, they don't know what's going on the field, but patients know. Users sitting on users committees elected by their peers know what's going on.
Paul Brunet of the Conseil pour la protection des maladies says they did not get a seat on the board of directors of Sante Quebec.
We did the job of feeding them with things that don't work and things that need to be amended or changed or directed to in some other ways. We've been doing that for almost 20 years now.
On November 10th, Quebec Health Minister Christian Dubé posted this on his social media, stating a review of the Bill 15 articles that deal with complaints by patients as well as those concerning users' committees was completed. Dubé introduced Bill 15 earlier this year, a bill that aims to create Sante Quebec, which would be responsible for the day-to-day operations of the health network. Dubé has said a more organized structure at the top will lead to reduced wait times in emergency rooms and surgeries and improve the overall patient experience. However, last month, 6 former Quebec premiers wrote an open letter voicing their concerns over the bill.
I believe they need to be able to voice themselves and what they think is positive and negative with regards to what's going on with our healthcare system.
Naveed Hussain, a nurse at the MUHC, also emphasizes the importance of having a patient advocate voice on the board.
Let's just say during the COVID crisis, during the pandemic, we had patients who were like day surgery patients who were having their surgeries postponed throughout the year. So you had patients who were in like pain, who needed like surgeries that could have been done rapidly, and they were unable to do those, and they didn't really have a voice.
Melanie Jade Boulouris, CEO of Nomadic Nurse Agency, says the lack of patient representation could lead to communication gaps.
We are going to have huge gaps in the communication from the patients, the healthcare professionals, to the board members, to the cabinet seats.
City News reached out to the health minister's office for comments, but did not hear back in time for broadcast.
We hope that the minister will come to terms before the adoption of the bill.
In Montreal, Swidda Rassy, City News.